Hello there, and I'm so happy to say we're joined by Mr. Jonathan Britto, an esteemed plastic surgeon, and his delightful colleague Karen to really enlighten us and share their insights on facial fillers and facial implants today. So, well, Mr. Britto, if you'd like to maybe answer our first question today with regards to a facelift. What exactly is a facelift?
A facelift is a work of art, Connor. So a facelift is a way to address the signs of facial aging, which affect us all, men and women. And the face ages in a generally systematic way with some bespoke and individual variations. But the shape of the face changes with age as the laxity of the layers of the face accumulates with time. So the purpose of a facelift is to restore shape and definition. And the second purpose of a facelift is to banish the shadows and introduce the reflection of light. Now, we have 5 layers in the face, from up here, the vertex, to down here in the neck. And those facial layers change in their relationship as we get older. So that we have definition in the eyelid, in the lower eye. The lower eyelid vertical height gets longer, and we accumulate a ski slope of light and dark in the face as we come down the face to the corner of the mouth. The weight of the face creates a shadow from the corner of the nose to the corner of the mouth, and then from the corner of the mouth to the jawline, with a loss of definition in the jawline. So various different facelift techniques can address all of these things and down into the neck in order to reverse those things and create a shape of youth.
Absolutely fantastic, Mr. Britto. A lovely description there. And I suppose for anybody who is considering a facelift, when is the right time, or when is the ideal time to consider getting a facelift?
So I would say to you that facelifting is not about a date of birth in men or in women. So the youngest patient that I've done a facelift for is probably in their late 30s. And the oldest would be in their early 80s. So it's not about a date of birth. The principles are similar from the 30s to the 80s, but clearly the individual techniques are different in that range of age. So there's no ideal time. The ideal time is when there's a loss of confidence in facial appearance. Do you agree with that?
Absolutely, yes. And as Jonathan said, it very much depends on the aging profile of the patient. But because we also have the various techniques within the family of facelifts, patients might just consider a facelift as one size fits all. But because there are so many different techniques, men and women can have them earlier in life, and not what we would consider the traditional full face lift, and then maybe later on, years later, go for another procedure. So there are so many different varieties to fit all different aging profiles.
That's a very interesting thing, actually, you picked up on, Karen. With years down the line, patients can return to have another facelift. Is there a certain number or an average number of facelifts somebody should be undergoing?
So there's no should. It's all about responding to an anxiety or a challenge. So there's no absolute number. The idea is to design the facelift to meet the aims of the patient, if that can be done. Because one of the things that we want to avoid with facelifting is missed expectation. So we want to make sure that the destination of our patients can be met by the destination of the techniques that are applied. And if we do that, we can have facelifts from the late 30s to the 80s, depending upon other factors like general health and so on.
Absolutely. That's very reassuring to hear that, you can go for as many as you wish for, as long as the benefits, outweigh the potential risks then. And are there any risks associated with the facelift?
So I guess there are two types of risk, really. One is a physical risk, damage to the tissues or an unexpected event that changes the outcome. And then the other type of risk is not meeting the expectation, which leads to disappointment. And the purpose of facelifting is to bring back confidence. It's to create well-being, which is an important part of health. So we regard facelifting very much as a medical event. We're not buying a handbag. And we want to make sure that the expectations of the patient are met, and design the facelift appropriately. So one of the risks, of course, is not meeting that expectation and having an inherent expectation gap. And we want to close that gap as much as possible. And thankfully, we've got very good outcome measures now in facelifting. So we know that our facelifts do meet patients' expectations. So that's one risk. And we're very happy that we've got the evidence to show that we avoid that risk as much as possible. And then there are other types of risk, and the face, as I said, is in like an onion in layers. And layer 1, the outside is skin, right the way through. Layer 3 is muscle, layer 5 is the covering of bone. And each of those layers has a potential risk related to it. And so we want to make sure that we advise our patients of what those risks are. And of course, in thinking about those risks when we talk to our patients, we make pretty sure that we avoid them when we actually do the surgery. And thankfully, our risk profiles in our practice are very low indeed.
And I think adding to that, that lead up to the surgery is so important with the consultation process, because often patients don't have an idea of what can and can't be achieved. And they do think it's very much about the skin and, just pulling back. And, oh, look what happens when this, all my wrinkles go and my pores look better and everything else. And we have to really educate our patients in what can be achieved with surgery, and then what else we can achieve with adjunct skin conditioning through injectables or topicals, so that they really do fully understand the process of what can be achieved.
Absolutely. That is a very important point as well. Maybe some patients might expect to see an improvement in some skin conditions, and maybe their expectations might be a little bit off in terms of that. Are there any skin conditions that patients want to get treated normally with a facelift, or?
Many, and largely to do with pigmentation or to do with inherent wrinkling. So a facelift will deal with laxity in the layers of the face, but it won't deal with fixed wrinkles within the skin. And so the key is having a full suite of treatments that relate to a facial appearance that go beyond the conditioning, the harmony of the skin, the wrinkling, dynamic wrinkling related to the way the muscles work, some fine sculpting of fixed wrinkles, things like that. So the other types of, as Karen says, adjunctive treatments that might be topical, they might be injectable, they might be machine or energy-based, lasers and so on. All of these things come into the discussion about facelifting. And I think an important thing to say is the successful facelift is a partnership. It's a partnership between preparing for surgery, skin health, anesthesia, surgery, and the patient. The patient has to understand what we're intending to deliver. And if there's a good partnership of understanding, there'll be a fantastic result.
And I think the post-surgery, one of the biggest questions is, how long will my facelift last? And we again have to speak about the fact that maintenance is so important. So patients may be having some cosmetic injectables before a facelift, and they think that a facelift then will mean that they never have to have those again. And that is normally not the case. Part of the maintenance from a health perspective is very important, and we educate them on lifestyle factors, but also from some of the injectables or topicals that they would need to maintain. Not everybody, I mean, everybody's different, so we make a bespoke plan for everybody as part of that maintenance, and the maintenance can then make the longevity of the facelift, even greater.
Absolutely. Thank you very, very much for that elaborative analysis there. It's fantastic to hear about facelifts in depth, certainly. So, and then moving on then to dermal fillers, and how exactly do facelifts differ from facial fillers?
Well, they're not interchangeable, Connor. So the facelift is a way of rebalancing the layers of the face, and it can restore the relationship between all the layers of the face to bring back shape, definition, get rid of shadows. Fillers can act in all of those layers of the face, but are much more targeted, certainly in the way I use them. So fillers are a very powerful tool. You can reach for a filler off the shelf, and they are a huge range of fillers. And the basic fillers are about volume, and they're about treating focal areas of loss of volume and shadow. So that's the first type of filler. Then we can use, in that suite of fillers, we can sculpt fine lines and wrinkles, or we can sculpt areas of volume. But that's not substitute, or it's not an alternative for a facelift in the traditional sense. Then there are a whole load of other types of fillers with additives called skin boosters, and Karen can tell us all about.
Yes, we're coming to a really exciting time where there's so much available now. In the right hands, they can be used just beautifully. So when we talk about skin conditioning, we often think about that as topical skin care. But now we've actually got injectable skin care in the form of biostimulators, biomodulators, biorevitalization. There's all sorts of words for it. But basically, we're stimulating the biology of the skin. So whereas fillers tend to augment, and there's nothing wrong with augmentation, however, in hands that aren't using them so well, they can be very obvious. But what we're looking to do more so now is stimulate the biology of the skin. So somebody's natural, stimulate their collagen, their elastin, so to make the skin work harder for longer. And we use those beautifully with, particularly in the neck, places which once were very, very difficult to treat. So we've got so many tools now available to give just naturally beautiful results.
It's a full orchestra.
Yeah,
it makes great music.
That's a fantastic way to put it, Mr. Britto. Absolutely. Fantastic. So the difference there, dermal fillers and facelifts, fantastic. And then I suppose the ideal candidate for facial fillers, is it a similar patient profile to a facelift?
There's an overlap in terms of patient profile between facelifting techniques and filler techniques. So there is an overlap. But the main use of the two types of strategies is a bit different. So where the overlap lies is probably jawline definition, volume loss in the mid-face. And different people have very strongly held views about which is best. I like to use natural tissues to regain youthfulness. I like to put those tissues back where they were in positions of youth. So that tends to be more surgical. But fillers can deliver a change of shape that patients may have never had, because you can keep adding filler if you want to. And also fillers can treat very fine areas of if you like, flaw in the envelope of the face. And they're very powerful at doing that. And used together, fillers and surgery can do tremendous things. For example, in the lip, a lip lift together with a little boost to the vermilion of the lip, will generate a very youthful and volumized, shapely lip. So they tend to work together in those things.
Fantastic. And I suppose for any patient considering any facial surgery for the first time, is there any surgery that you would typically recommend, whether it be a facelift or facial fillers? Any, I suppose, safer or a better option at the beginning for their first surgery?
It's a really interesting point. So patients will come in and they will say, I want a bit of filler, and they'll even give you a product name. Or they'll say, I don't want this particular facelift, I want that particular facelift. What we do is, instead of looking at it in that way, we will say, well, what's the problem? Sit in front of the mirror, what don't you like? What is it about your face that gives you a loss of confidence? And then I might leave and Karen might have a chat, because they will say things, men and women will say things differently to other men and women. So we'll get a complete picture of what they actually want, or what what creates the loss of anxiety, because it's a big deal to come and sit in front of a plastic surgeon and the team and spend some money and give some time and make yourself vulnerable. So we want to build confidence. Once we've got a clear idea of what the problem is, then you apply it might be a filler, it might be a laser, it might be a chemical peel, or it might be a facelift, or it might be a combination of all of those things.
And it's about choice as well, and giving options. So the important thing is to discuss options with patients, explain what you feel are the better options, which will give them the best outcomes. But for some patients, for example, surgery isn't an option through cost or fear or whatever, and also what other people might think. So we may have to look at other options. We explained how that sort of works with what their expectations are and what they should achieve from it. But it's really important to go through those options, because, as I say, it's not sort of one thing fits all. There's lots of things to discuss before the decisions are made.
Fantastic. And then, guys, just one final question then on the topic. And in terms of recovery time, is recovery time similar in both facelift recovery and dermal facial filler recovery?
Well, the good news is that the facelift recovery times are much faster than they used to be, much less downtime. So most of my facial surgery now is done with what we call twilight anesthetic. So you don't need a general anesthetic. It's beautifully safe. The recovery time is much faster. No anesthetic downtime, day case surgery, no drains, much more comfortable as an experience. Much better outcomes, I have to say, too, because there's less bruising, there's less swelling. The surgery is much more accurate to the dynamic face. So the recovery times from facelift surgery, all the types of facelift surgery, in any layer of the face and from the vertex to the neck, are much faster than they used to be. So return to work, return to the gym, return to normal life, much faster than it used to be. For fillers, I think the precision of the filler treatments makes filler recovery much faster as well. I think see that in clinic, the two. Much less swelling, much less bruising, much softer results. No advice to massage and all that anymore, because the range of fillers is much more choice now. So the recovery times are much faster, and it is, of course, an outpatient clinic-based treatment.
Absolutely fantastic, Mr. Britto and Karen. Thank you both so much again for your time and your insights about facelifts and facial fillers. And it's been a pleasure. And if anybody watching today's video would like more information about Mr. Britto and Karen's work, you can simply visit Mr. Britto's Top Doctors profile at www.topdoctors.co.uk, and hopefully the right treatment plan will be delivered to you and in the safe hands of Mr. Britto and Karen. Thank you both very, very much.
Thank you, guys. Cheers. Bye-bye.
Thank you, guys.